Good evening, and thank you so much for tuning in. My name is Ariel Thomas. I am the Health Policy Coordinator at the Metropolitan Chicago Breast Cancer Task Force, and I'm so delighted that our board member, Brandon Johnson, is here to join us so we can talk about the Affordable Care Act and the repeal of that act. Thank you, Brandon, for being here with us.
Thank you, Ms. Thomas.
I really appreciate you. So just for those who don't know, the Breast Cancer Task Force is a nonprofit that is dedicated to the fight to end the breast cancer mortality disparity in the metro Chicago area. We do have three programmatic areas which focus on quality improvement, advocacy, and community health and navigation. I would like to show you our website, so feel free to visit our website at chicagobreastcancer.org. Our contact information is here. Please do email us at advocacy@chicagobreastcancer.org if you have any questions in regards to advocacy or in regards to ACA. And we are located at 300 South Ashland Avenue, Suite 202 in Chicago, 60607. So Brandon, again, thank you so much for being here. Could you tell me why you're interested in the breast cancer health disparity?
Yes, I think that breast cancer speaks to an issue not only that affects all families, for all families have women in it, but it's also an issue that highlights some of the structural and institutional inequities in our healthcare system.
Wow, so profound, and directly ties into our mission because unfortunately, in the research that we found with our community partners, we found that health systems, actually the disparity in quality of the health services provided to communities in underserved areas and communities of color really amount to lower health outcomes or poorer health outcomes. And so we've seen this in, unfortunately, outcomes with breast cancer. So this is something that we work hard with every day to fight. So as you know, as most of you guys know, the Affordable Care Act, also known as Obamacare, the repeal process is in motion. And so this is what we're going to be focused on today. We're so happy to have Brandon here, who is an attorney and also, as I mentioned, a board member for the task force. So could you talk about, I know we've talked about how you believe that breast cancer disparity is a gateway issue into the bigger issue with health disparities in our communities.
Absolutely. So what we know about breast cancer is that it is absolutely a cancer. Cancer is one of the biggest killers of individuals in the United States and the world, but we also know that breast cancer is highly treatable if detected early and often. Mm-hmm. And so when I speak about breast cancer as a gateway issue, what we know is that if primarily women of color are able to get the proper screenings and preventative care, that they can be alerted to their condition and get treatment that reduces their chances of dying from breast cancer. I see it as a gateway issue because it is absolutely the preventative care that we have access to and our ability to navigate the system after we have our initial diagnosis that helps us to resolve our healthcare issues. And so with breast cancer, we have an issue that is 100% treatable, 100% curable, or not 100%, but mostly curable. Mm-hmm. And if we can simply navigate women of color into the system early and often, there are a number of lives we can save.
Absolutely. So, given the current events of the Affordable Care Act, which, as you may know, has insured over 22 million people since the mandate came into effect, is now the threat of repeal, a very real threat. So what do you think, this threat, or very real threat, means to, the lives of folks who, people of color, folks who don't have, the means to access affordable health care?
Right. So when we think about the Affordable Care Act, we primarily think about the insurance provisions of that bill. But the fact of the matter is that within the Affordable Care Act, there are a number of provisions that encourage people to be more proactive in going to the doctor. Mm-hmm. Provisions that prevent them from being discriminated against, i.e. The pre-existing conditions clause of the Affordable Care Act, and also provisions that, via the affordability and accessibility, take the fear and the barriers to entry of getting into the healthcare system out. And so when I think about the potential repeal of the Affordable Care Act, I think we're looking at two things. We're looking at individuals that, primarily for financial reasons, will be intimidated or precluded from entering the healthcare system. But I also think about the lingering and detrimental effects to the cost of healthcare for society as a whole. So we know that when we treat diseases early, when people are proactive about getting healthcare, the cost of healthcare declines. My fear is that any repeal of the Affordable Care Act that doesn't continue to encourage people to actively and proactively engage preventative care will continue to escalate the cost of healthcare for society as a whole, and begin to not only expand the cost, but increase our mortality and morbidity rates across the population.
Right. So I'm just curious, could you give us kind of an overview of what has happened so far in terms of how do we get to this point where now we're facing a repeal?
I think that's a loaded question. I humble myself in saying that I am probably not qualified to give a complete answer to that. But what I have heard, and I do believe, is that the Affordable Care Act was defined by its opponents and not its proponents. And so the benefits of the Affordable Care Act were grossly misunderstood by the larger population. The way that it impacted individuals, the way that it impacted the efficacy and affordability of the overall healthcare system, and its greater economic benefit to us as a country as a whole was grossly and ineptly understood by the general public. In the midst of that misunderstanding, the opponents of the Affordable Care Act, in my humble opinion, mostly driven by politics, sought to redefine it as a political issue on the right, driven by big government arguments, driven by arguments of increased cost to business, while missing the larger picture. And so what I believe is that the United States, with the highest care of health care for any industrialized nation, with the most regressive system of health care for any industrialized nation, is in dire circumstances, in that we could continue to regress. The Affordable Care Act gave us an opportunity to be the first amongst equals in the 21st century. I fear that if we repeal the Affordable Care Act and we're not smart about how we continue to progress healthcare policy in the United States, that we will find ourselves in third world circumstances when it comes to healthcare.
I do agree, and unfortunately, like you said, third world situations with our healthcare. Unfortunately, folks, who should have access, we're the richest, country in the world, with so many resources, but yet, folks, don't know how to access the basic, healthcare services to, like you said, prevent disease. It's ridiculous that, people die every day from things that are preventable. So again, definitely at the Breast Cancer Task Force, we, strongly advocate for preventative health care. Just to make a plug, we do go to Springfield every year for Advocacy Day, where we advocate for the Illinois Breast and Cervical Cancer Program, which is a state-funded program that provides free screening and treatment services for women who are underinsured or uninsured. And so underinsured, what does that mean? That means that you may have insurance, you may work, but the insurance doesn't cover you to get a mammogram, it doesn't cover you to get a pap smear or something like that. So it's very important for you to understand, your status, and I would like to say that even though the Affordable Care Act is in the process of being repealed, you still can sign up for it. It's not a repeal, if it goes through, does not, take immediate effect. I believe there's a 2-year delay. Correct me if I'm wrong. Folks can still sign up by the end of the month, January 31st, if you don't have health care and you think that's a good option for you. So I do want to mention that. Do you have any other thoughts about the Affordable Care Act? And not having a replacement plan, that's a big point too.
I guess my only other thought is that when we talk about advocacy under a Republican administration, and while we can't predict what President Trump will do, what we do know is that the trend of Republican administrations is to push down power to the states. And so if I was to make a prediction or to forecast how we can best serve ourselves as the state of Illinois and the city of Chicago, I would say that local and state advocacy are at a premium. I think no matter what happens on the federal level, I think our power to enact policy and legislation and disperse funds on the state level will only grow. And so no matter your political leanings, I think the notion of becoming more engaged on an advocacy and a policy level, both locally and on the state level, are at an all-time high.
Absolutely. I would like to mention on that note that the Metropolitan Chicago Breast Cancer Task Force does have a new initiative that we're starting off, and if you would like to get involved, please contact us at advocacy@chicagobreastcancer.org, or you can definitely follow us on the major social media platforms. But if you would like to learn more about our new initiative called the Advocacy Council, whereas we would like to provide members of the community with training, not just the task force to provide information to you, but we really want to learn from you, from the community, about what you care about in terms of advocacy, not just breast cancer related, but what do you want to learn about advocacy, who do you want to connect with in terms of your elected officials. The goal is to really be able to support community members communicating their their dreams, their hopes, their expectations to their elected officials on a local level, which is what Brandon is mentioning, really, strengthening, our resolve and communicating our needs to our elected officials on a local level, our aldermen, and, on the state level, our state representatives. More about this program, please do contact us at 312-942-3368, or you can email us at advocacy@chicagobreastcancer.org. So that's an initiative that we're working on, Brandon, but do you have any thoughts about other local initiatives that would be really meaningful during this time?
I think there are a lot of people doing a lot of good work in this space. But I know that everybody doesn't have the disposition to necessarily go engage in that way. What I've thought about, and when we talk about breast cancer as a gateway issue, what I've thought about is that most of us will encounter, even in the next year, a friend, a family member, a colleague, a church member that has breast cancer. Mm-hmm. Engage them. And the reason I say that is that the unique thing about breast cancer is that it's pervasive, it's common, and it engages our healthcare system in all the ways that are both challenging and meaningful. And when I say that, the life of a breast cancer patient or the life of the diagnosis and treatment of a breast cancer patient really is a great insight to our system. There's a screening. Somebody goes for a mammography, and in the course of the mammography, there's a question as to what kind of mammography did you have. After the mammography, there's an analysis of that mammography and whether or not that requires a biopsy or a next step. After the diagnosis, there's an assessment as to course of treatment. After that, there's the execution of that treatment, and then there's the follow-up. And because it's such a pervasive issue that touches all of us in our lives, because all of us have women in our lives, supporting, engaging, dialoguing with women with breast cancer is not only a great way to support your fellow human and a person in need, but it's a great way to learn about how our healthcare system works. And so while we speak specifically and address specifically breast cancer, I sincerely and wholeheartedly believe that our approach is universalist to all healthcare issues. And so if I could encourage anything in 2017, find a woman with breast cancer, support her in her journey, in her battle, and reach out to the Metropolitan Chicago Breast Cancer Task Force so we can be a resource as to help you both go through this battle and learn more about the healthcare system you face.
Absolutely. That's a great point. And I would like to urge anyone listening, if you have a question, please do give us a call. We are live, and we would love to hear from you. So feel free to give us a ring at the CAN TV at 312-738-1060. Now, Brandon, are there any local level health initiatives that provide, a means to access healthcare beyond the Affordable Care Act?
Well, there's absolutely county care, and President Preckwinkle, the Cook County Board President, was an early adapter of the infrastructure that would become the Affordable Care Act. And I think if you live in Cook County, we have an excellent public health care system that can connect you to a number of resources. And the name is slipping me. But there's Sisters, I believe Sisters Working It Out. Mm-hmm. Is a great organization that addresses breast cancer issues. And I would have to say our own organization, the Metropolitan Chicago Breast great number of screening and navigation opportunities for women of color with breast cancer. Could you speak to that?
Sure. Right. So we do have a robust navigation program where I believe we have navigated over 5,000 women through to screening mammograms. If women have an abnormal mammogram, they are able to get connected to get biopsy or diagnostic mammogram. We also do have a navigator, a nurse navigator, who helps women beyond the abnormal to really follow them through the process to make sure if they don't have the support from family or friends that, we have someone who's adequately trained and compassionate to help that lady go through that journey. And it looks like we do have a caller, so yes, caller, can you hear us?
Hello.
Hello.
Hi. So I wanted to ask you if you could sort of predict what the impact will be for people who do have pre-existing conditions who are currently enrolled in an Affordable Care Act health plan, like sort of what you expect the impact will be, particularly, for people who are, let's say, cancer patients who are presently receiving treatment. How do you expect they'll be impacted by the repeal?
Thank you, caller. That's a great question. Brandon, do you have any thoughts on that?
So I wouldn't give a hard, fast prediction. What I would do is I would maybe lay out some considerations. So one, it's going to be difficult to unwind the Affordable Care Act. So my inclination is that for those that are already insured, it's going to be hard for them to be dropped from their existing plans, but I think they'll be aggressive in finding ways to drop you. I think in terms of pre-existing conditions, I think the more pressing question is, if you're a person with a pre-existing condition and the Affordable Care Act is repealed, how do you maintain your care? And I think that comes down to being very engaged with your current healthcare provider, learning what their thoughts are about how they would transition, and discussing with them paths for continuity of care. I wish I could say that there's a more optimistic forecast, but we truly can't say at this point. But what I can say is that make sure that you do get enrolled with some kind of healthcare plan immediately, and be very aggressive in engaging your current provider with their future strategies and how you can stay covered no matter what the future circumstance will be.
Absolutely. I do recall reading that the incoming administration are considering, preserving the pre-existing conditions clause and a couple of other things. So it'll be interesting to see, okay, what's the difference between what we have now and what would be proposed if that were to be the case.
And I would go back to advocacy. And so what I do believe is that state and local power will be at a premium, given the current administration. What I do believe and what I do know is that between the city, the county, and the state, we do have an infrastructure that can take care of people. And so what we have seen even under the Affordable Care Act is a mass exodus by for-profit companies from this plan. But what I also know is that we have great county leadership, great city leadership, and great leadership in places at the state level. And if we are strong advocates, which we need to be now more so than ever, I believe that we can work through a local and state solution that will preserve care. So that would be my answer.
Absolutely. And I would like to mention again, in line with what Brandon is talking about really, let's get engaged, reach out to your local community organizations who you have an affinity with. And if that's the Metropolitan Chicago Breast Cancer Task Force, awesome. Please do reach out to us. Give us a call at 312-942-3368, or you can email us at advocacy@chicagobreastcancer.org. We do have a website, and it is www.chicagobreastcancer.org. And give you a look. So we just have 2 minutes left. Again, if there are anyone with questions, please do give us a call. 312-738-1060. Brandon, any closing words?
Yes, this is outreach. This is us letting you know that we exist. What we would encourage you to do is take our contact information, which has been shown several times throughout the course of this program. And if you are a part of a church, a local organization, a block club, etc., reach out to us. Allow us to come out to you, and let's figure out together through the lens of breast cancer how we can better tackle current and existing and future disparities in healthcare and make our communities a healthier place to live.
Absolutely. So well put. Thank you so much. And actually, I
Thank
just
you.
want to plug that Donna Lynn, our wonderful outreach staff person, is our producer, and she does so much work in the community, visiting churches, providing educational information about, breast health and prevention. And so, this is something that we are really passionate about, and we really would like to connect with you. So please do give us a call, email, visit our website, and I will, one last time, show it to you so you can give us a ring. So we are at 300 South Ashland Avenue. Give us a call at 312-942-3368. Our website is chicagobreastcancer.org, and you can send us a message at advocacy@breastcancer.org. Thank you so much for tuning in. Please check us out next month. Thank you. Thanks,
Thank
Brandon.
you.